Hey guys, welcome to Medifaction. So today we're going to learn about the anatomy of cubital fossa. So the cubital fossa, or simply the elbow pit, is a small triangular depression in the arm which is formed by the connection of the humerus right here and with the radius and ulna of the forearm. This here is the forearm and this here is the arm. So to learn more about it, let's go deeper. So in this video, I'm going to enumerate an introduction about the cubital fossa, and we are also going to discuss about the boundaries of cubital fossa and also about the roof, the floor, and the contents in the cubital fossa. And finally, we are going to wind up this session with discussing about some important clinical anatomy of cubital fossa. So let's begin. Introduction. The cubital fossa is an area of transition between the anatomical arm, this is the arm, and the forearm, right here. So it is located in a depression on the anterior surface of the elbow joint. It is also called the antecubital fossa because it lies in anterior of the elbow. So let's learn more about it. Talking about boundaries. So laterally, it is bounded by the medial border of brachioradialis muscle. So this right here is the brachioradialis muscle which forms laterally. Medially, it is formed by the lateral border of the pronator teres muscle. So this here is the pronator teres muscle which bounds medially. In base, the base is directed upwards and is represented by an imaginary line joining the front of two epicondyles of the humerus. So right here you can appreciate the imaginary line forming the base which is directed upwards. And about the apex, this right here is the apex which is directed downwards and is formed by the meeting point of the lateral and medial boundaries, that is these two muscles. Now about the roof. The roof of the cubital fossa is formed by skin, obviously, then the superficial fascia containing the median cubital vein. Here you can see the median cubital vein joining the cephalic and basilic veins. This is the basilic vein and this is the cephalic vein. So these two veins are joined by our median cubital vein which is found on the roof. The lateral cutaneous nerve of forearm lies along with cephalic vein and the medial cutaneous nerve of forearm along with basilic vein. So this is the lateral cutaneous nerve of forearm along with the cephalic vein, and as I told, the medial cutaneous nerve of forearm right here along with the basilic vein. Also we can appreciate the deep fascia and bicipital aponeurosis. This right here is the aponeurosis which is marked like a web. Floor. It is formed by the brachialis muscle and supinator surrounding the upper part of radius bone. This forms the floor. Contents. The fossa is actually very narrow. The contents described are seen after retracting the boundaries. So from medial to the lateral side, the contents are as follows. Number 1, or the medialmost content, is the median nerve. It gives branches to flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and leaves the fossa by passing between the two heads of pronator teres muscle. Number 2, is the termination of the brachial artery, and after that it divides into the radial and ulnar arteries at this point of the fossa. The radial artery is smaller and more superficial than the ulnar artery, so we call it superficial radial artery. It gives off the radial recurrent branch. The ulnar artery goes deep to both heads of pronator teres muscle and runs downwards and medially, being separated from the median nerve by the deep head of the pronator teres muscle. Ulnar artery gives off the anterior ulnar recurrent, the posterior ulnar recurrent, and the common introitious branches. The common introitious branch divides into the anterior and posterior introitious arteries and later gives off the introitious recurrent branch. The third content is the tendon of biceps brachii with the bicipital aponeurosis. The fourth content is the radial nerve, which is accompanied by the radial collateral artery, which appears in the gap between the brachialis medially and the brachioradialis and extensor carpi radialis longus laterally. While running in the intermuscular gap, radial nerve supplies the three flanking muscles, and just below the level of the lateral epicondyle, it gives off the posterior introitious nerve or deep branch of the radial nerve, which leaves the fossa by piercing the supinator muscle. The remaining superficial branch runs in front of the forearm for some distance. So, in order to learn this order from median to lateral, we can remember the mnemonic MBBS, which is the median nerve on the medianmost side. Just adjacent to it, we can appreciate the brachial artery. Just near to it is the bicipital tendon or a bicipital aponeurosis, and the lateral part is radial nerve or superficial branch of radial nerve. Moving on to the clinical anatomy. The cubital region is important for the following reasons. The median cubital vein is often the vein of choice for intravenous injections. The blood pressure is universally recorded by auscultating the brachial artery in the front of the elbow. The anatomy of the cubital fossa is useful while dealing with the fracture around the elbow, like the supracondylar fracture of the humerus. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.